All right, come on in, have a seat. Today, we're diving straight into the clinic for an explainer on the brand new 2026 cholesterol guidelines. I want you to imagine we're sitting right across from each other in the exam room. You're in for a checkup, we've run your labs, and it's time for a real, honest conversation about your heart. You see, the American College of Cardiology and the American Heart Association just dropped their massive 2026 guideline on the management of dyslipidemia. And honestly, it completely changes the game on how we assess your risk and treat your cholesterol.
Now, I hear this exact question literally every single day. Doc, I have high blood pressure. Am I going to have a heart attack? And look, I get it. I absolutely understand why you're concerned. When you get told a vital sign is out of range, your brain instantly jumps to the absolute worst-case scenario, right? But take a breath. Instead of panicking, we're going to use the latest data today to build you a rock-solid, completely personalized plan.
First off, let's validate those fears for a second. We need to look at the reality of how blood pressure, blood sugar, and cholesterol are deeply intertwined in your body. They're usually linked by this underlying issue called insulin resistance. So if you're dealing with multiple risk factors at once, trust me, you are absolutely not alone in this.
Just take a look at this staggering number, 96.1%. There was a recent 2023 study out of a major cardiac center in Kathmandu, Nepal, and they looked really closely at patients coming in with high blood pressure. What they found was wild. An overwhelming 96.1% of these newly diagnosed hypertensive patients also suffered from reduced HDL. You know, that's your good cholesterol. So nearly every single person in that group with high blood pressure was also walking around with a dangerous cholesterol imbalance.
And the numbers break down even further to show just how connected this all is. Among those exact same high blood pressure patients, about 29% also had diabetes and over 35% were pre-diabetic. Even crazier, a whopping 86% had elevated LDL, the bad cholesterol. So the big takeaway here is that things like diabetes, high blood pressure, and cholesterol issues don't just happen in a vacuum. They clump together and they multiply your overall risk. If we spot one, we absolutely have to go hunting for the others.
But hey, here is the genuinely good news. The new 2026 guidelines give us much better tools to predict and prevent that heart attack you're so worried about. We're basically getting a massive software update to our diagnostic tools.
For years, your doctor probably used something called the pooled cohort equations, or PCE, to sort of guess your 10-year risk of getting heart disease. Well, the 2026 guidelines officially tossed that old calculator out the window. We're upgrading our GPS to the brand new Prevent ASCVD equations. This new system is incredibly accurate for figuring out not just your 10-year risk, but, and this is huge, your 30-year risk. That longer horizon helps us make much smarter, proactive choices about your treatment.
You can think of this as our new CPR playbook for preventing heart disease, CPR. First, we calculate your baseline risk using those new Prevent equations. Next, we personalize it. We look at the unique factors in your life and your genetics that a basic calculator might miss. And finally, we reclassify. Based on some advanced testing, we might shift your risk category up or down and totally reassess our game plan. It's tailored entirely to you.
Now you might be wondering, what if your risk isn't super obvious right off the bat? What if you're the kind of person who eats right, runs miles a week, but you still have a family history of early heart attacks? Well, that brings us to one of the most fascinating updates in the 2026 guidelines. We need to look closely at something called lipoprotein(a), or just LPA for short. This is essentially an LDL-like cholesterol particle, but here's the catch. The amount you have floating in your blood is almost entirely determined by your DNA. It's a completely independent cardiovascular risk factor. It's literally a genetic blueprint for cholesterol risk that we can't just fix with a salad or hitting the treadmill. But we absolutely have to know it's there so we can plan around it.
So why is everyone suddenly talking about this? Well, the 2026 guidelines now make it a top-tier recommendation to check your LPA levels at least once as an adult. Just once. Because it's genetic, the level pretty much stays the same your whole life, totally unaffected by lifestyle changes. If your test comes back over 50 milligrams per deciliter, we know your risk for heart disease jumps up by about 40%. Finding that out early means we know we have to be super aggressive about controlling all your other risk factors. Plus, it triggers what we call cascade testing. That just means if you have it, we instantly know to check your kids and your siblings too.
Okay, so what if we've run your Prevent score? We've checked your genetics and, honestly, we're still on the fence about what to do. If we need just a bit more data to perfect your care plan, we actually have a way to look directly inside your arteries.
We do this using a super quick CT scan called coronary artery calcium scoring, or a CAC score. The new guidelines love using this to break ties. If we're debating whether or not to put you on cholesterol medication and your CAC score comes back as a perfect 0, that is phenomenal news. It means we can safely hold off on the statins. But if that score is over 100, the guidelines don't mess around. It means plaque is already building up in your heart's plumbing, and we need to start you on lipid-lowering therapy right away.
All right, take a breath. We've gathered a ton of data about your unique cardiovascular profile. But what do you actually do with all this information today, like right now, as you walk out the clinic doors?
Well, perhaps the most crucial takeaway from the new guidelines is that we have to treat cholesterol issues much, much earlier in life. We're talking about primordial prevention here. Think of it like this. The total amount of time your blood vessels are exposed to that bad, plaque-building cholesterol over your entire life is what truly dictates your risk. So, the healthy lifestyle habits you build in your youth and young adulthood literally set the stage for your lifelong heart health.
So your everyday, real-world prescription starts with the pillars of lifestyle. We're talking a genuinely heart-healthy diet, breaking a sweat regularly, completely ditching any nicotine products, seriously, 0 nicotine, getting good sleep, and managing your weight. And I love this part. The 2026 guidelines tell doctors we can't just hand you a pamphlet and say, eat better. No way. They highly recommend referring you to a registered dietitian nutritionist, an RDN, so you actually have an expert in your corner to make these dietary changes realistic and sustainable.
Now, I want to be totally real with you. Sometimes, even if you are absolutely crushing it in the kitchen and the gym, biology still wins. And when lifestyle alone isn't quite enough to drop your risk, our medical toolkit has some incredible new upgrades.
We now have some seriously aggressive targets for driving down your bad cholesterol. If our new math shows you're in the high-risk category, our goal is to crush your LDL down below 70 milligrams per deciliter. But if you're very high risk, like if you've already had a heart event in the past, we want that LDL driven all the way down below 55. The data is super clear on this. Maintaining those super low levels is how we stop future heart attacks in their tracks.
To get you to those targets, statins are still our absolute go-to first-line defense. They're incredibly safe, highly effective, and we have literally decades of data backing them up. We do have to double-check for any drug interactions, of course, since a lot of folks take multiple meds. But if statins aren't quite doing the trick, or if your body just doesn't tolerate them, the 2026 Playbook brings in the heavy hitters. We've got non-statin options like ezetimibe pills or injectable PCSK9 inhibitors. Plus, they've officially added bempedoic acid to the mix for 2026. That's another daily pill we can use to make sure our highest risk patients actually hit those protective targets.
So, as we wrap up our little clinical consult today, I want to bounce the question right back to you. Armed with this brand new understanding of your true risk, knowing how genetics like LPA play a role, and having all these powerful new lifestyle and medical tools at your disposal, what changes are you going to make today? I really encourage you to take the insights from this explainer, take a hard look at your daily habits, and feel empowered to schedule this exact conversation with your own doctor. Your heart health is in your hands, and honestly, the playbook has never been clearer.